Is visible? My screen is visible. PPT. Hello.
Yes, sir, it is visible now.
Okay, fine, fine. Good evening, everyone. Today we are taking most important part of our clinical sexual medicine part. Some part it also helping in dermatological cases as well. And this session is just continuing session to the what we conducted so far. Two sessions. This is our third session. The main objective of this WHO Institute of Sexology and Psychosexual Counseling is provide the scientific knowledge along with this practical training in this field. This is a government recognized startup, WHO Healthcare, and it is also internationally accepted and under institutional ex-institutional membership. And I'm certified sexology sex educator at the American Board of Sexology. I'm attached here in Pune in Aditya Birla Memorial Hospital as a sexual medicine consultant and ex-assistant professor in DY PM Medical College, Pune. Now, session 2, almost we have completed counseling. So I want everyone must do the counseling assignment. Minimum requirement is minimum 10 patients counseling. You should do it. In this counseling, you should evaluate the personality of the person whom they were coming to you. Maybe powerful, maybe popular, maybe peaceful and perfect. Every personality you write down. There are 40 questionnaires. We explain you, and that way you make the your report. This is the personality, the weaker personality you have to treat by this suggestion or advice. In this way, you complete your counseling session of personality evaluation individual wise, and we are going to see the remaining part of the counseling in depth and understanding how you can use it clinically at your practice and how we are using in our center. We are already completed what is counseling, how it works. You know, counseling is not any medicine or not any advice. Counseling is something that you have to change the mind or barrier of the patient so that he can change himself. For example, when the patient comes to you, their relationship is not proper, husband and wife after post marriage counseling, we teach them. They come to you. First, we keep everything secret. We are not disclosing any counseling part to anyone. We do the individual counseling, individual questionnaires, each partner, male and female. Then we call them. What is their, why they want the divorce or why they are interested not living together and all. And that time we ask them, you have to stay in a one same, but you don't go for any complaining each other, but don't talk, only silence, maintain the silence for the 4 weeks counseling session. at home. And just you write down whatever. You can stay in the same house, same, you can even hug each other, you can do whatever work you are doing routinely. But most of the time, patient comes for they want the divorce. Before that, we say, okay, you will get the divorce, don't worry about that. Then they release their tension, stress. Stress relieving is very important factor in counseling. And then we ask the both the partners, write down what you want in your life. What is your aim and objective in life? Second, write down responsibility. Suppose there are two students, one got 400 mark out of 450 by reading all the from A to read all the books and studying hard and everything. Second student B get 400 out of 450 by following the teacher and taken the mark list and does it. Who is the leader and who is the follower? A is the leader, B is a follower. You must be a leader in the life, not a follower. One thing, we always be a responsible person. Yes, married this lady. At that time, you are interested. Yes. So who is responsible? Good natural male part says, I am responsible. Female partner will say, I am responsible. This is coming from inside. That is the changing the behavior of patient. This is one example I'm telling you. This is the way what we give them assignment of each and every patient to do the work at home. And this is the way what you have to do the counseling and use it in your practice. Then it becomes the effective counselor. It becomes the effective counselor. Whatever in your subconscious mind, because 10% is conscious. Conscious mind is what you are observing. I'm talking with you, and this is only 10% of mind. It's a conscious level. Sometimes read some books and some misconception develop, and that circulate in subconscious mind. Subconscious mind works 4 hours, and conscious mind work only when you are awakened state. That is 15 to 16 hours in a day, out of 24 hours. And this conscious mind is repeated again and again, and that percolated in subconscious mind, and subconscious mind feel it is a reality. That is illogical, but it feels a reality, and that's why they have the myth and misconception in their mind. You have to remove that myth from the patient's mind during your counseling session. It is a psychotherapy, cognitive behavior therapy. We are going to see in the next slides. But this remember in the broad sense, you have to prepare your own module of counseling and become a good counselor, because counseling is very important factors in a day-to-day life because of the stress of all the type of stress at home, residential stress, by workplace stress, by anxiety, financial stress, and so on. Number of stress. But you have to be relaxed. Everything is happening smoothly. Just observe it. That is the solution. You have to motivate your patient or make them stronger so that they can accept the challenges in life. Conscious mind is only 10%. Then the willpower, long-term memory, logical thinking, and critical thinking. Just we are completed in the previous. That again I am repeating for your better counseling session with the patients. That is very important with patients. You have to send me digitally so that I will give you one extra certificate that is 250 credit marks because we need your all work you did it in the form of transcripts. That is a legal way to authorize you have done some work in reality. Then and then certification will you get this certificate. Then you get your degree and all. But this this extra certificate we need to keep all your documentation. What is the subconscious mind? Subconscious mind works 24 hours. That is the 90%. That is the belief. Whatever belief, you have to remove this wrong myth and misconception from your subconscious mind. Exploration of subconscious mind, emotions, habits, memory. This is now counseling. My dear friend, raise your mic. Just mute your mic. The co-host will add you in our session. Now, counseling, we develop this counseling. Before that, we develop the love map to kind of the gender identification. Whatever the way you are taking the medical history, you add nothing, ask each and every one who's coming for psychosexual counseling, their love mapping, ask them when the first crush and what age you started. Suppose their first crush is the opposite sex, then the heterosexual, in the same sex, then homosexual, in which gay in the male, lesbian in the female, so on. This is the way you can have certain extent some guideline by law. WHO personality test is very important. What I explain you just and send you assignments, write up and everything to you. 40 questionnaires. Every question is 1 mark. It's you need 20 are weaknesses and 20 are strength. Find out the weaknesses and strengths of the patient, your client, and find out the which personalities got more marks. Suppose we are going to see that also. Before that, I like to complete this. Sexuality includes physical, ethical, spiritual, psychological, emotional dimensions. Great psychologist, actually, he's a neurophysician, Dr. Sigmund Freud, neurologist, knows that psychosexual development in childhood take place during 5 psychosexual stages after the birth of the baby. When he start from 0 to 1.5 year, or when he learn by the breastfeeding, then anal stage, that is from 1.5 to 3.5, then phallic stage, latency and genital stage. If something is happened wrong, we develop these things. They develop the confusion, and that affect in their elderly life in the form of psychologists. Most of the psychologists consider as a homosexuality and gay pattern, and there is no scientific data. There is no any hormonal changes in the body so far. If you investigate all the investigations are normal, still the patient are not heterosexual, they are homosexuals. I had one patient, they're mostly married, he was a gay, absolute gay, exclusively homosexual. And when he said when he was on the partner, he don't like to touch the female part, female, female, even she touched the hand. He feel that he just throw it out and leave this place. These are the way he explained. You get the various story about the forcefully married this homosexual or gay or transgender and so on, queer and so on. Mostly states are heterosexual, 80% in society, 20% includes all homosexuals, bisexuals, transgender, and so on. Low map is a mental pattern expressed in every individual sex, erotic fantasies, and practices. It is unique for everyone. It is developed before the age of 8 years and is executed after puberty. That what explained just now. Children get their low by engaging in sexual rehearsal play when the play is not interfered with by the teacher or by the society. The low map developed as heterosexual. The unconsciously, subconsciously mind is influence personality. Personality influence relationship problem. In personality problem in relationship, identify strength and weaknesses. Keep the strength untouched. You can't change the strength because the strength is a God given gift. And identify the classes but softer personality. There is improved weaknesses in match with the partner. In short, and we will see in the personality evaluation how we are doing at our clinic so that your idea will be clear. What is our goal? The WHO Institute of Sexology and Sexual Health aims to promote the development and establishment of sexology within the broader multidisciplinary approach and create a culture of sexual health among the Indian population. So the initiation and implementation of programs in the field of sexual health, education, and science. And we have created this counseling. So many people think counseling is giving advice or offering solution to the problem. Counseling is one of these when the client comes for help with the problem, he is putting something in himself to solve it. This may be change of attitude, change of perception of self, and change of perception of others, habit, change of habit, or a change of behavior. Counseling is teaching life coping skills. So that register student every month assignment, personality evaluation minimum, every personality self personality evaluation. You first go for your own personality evaluation, find out the 20 weakness and 20 strength of each personality. Personality scoring sheets I given you. Personality awareness workshop. Uh, Everything I sent to you in the group. If not received, you can call me. I will send you personally on your WhatsApp. And if you want any books, you can clear me link for office works. The timing that is around 12 6 p.m. I'm in my clinic. Help you. Once you complete the training, then directly you can improve weaknesses, take the evaluation for 100 cases. But if not possible, then you minimum 10 cases you send us so that we will provide you all the assignment questions. We will provide you a extra certificate that is a 250 to 350 per course certification with the tantric. If any difficulty, we will help you. Personality matrix, the experience of people will know very well. Goal and aim for counseling to understand the counselor's current situation, to understand how he has tried to handle the problem, to understand his views of the problem. Identify the strengths and weaknesses, keep the strength and clutch, identify the classes of partner personality, improve the weaknesses in every couple. Counseling couple therapy, people personality, perfect personality, good personality. Suppose the couple is married to people perfect, then they think that there is not uh, up to their mark. We have to give them advice that it is not the problem of the person, it is the problem of their personality, it is not get it is powerful, popular. So you take other partner. If he or she is peaceful and perfect, become a powerful and popular so that we match the things. Otherwise, you can provide them. There is no training course for teaching role of ideal husband or ideal wife worldwide. Happy marriage is gifted when you develop ability to speak and keep healthy relationship after personality test and emotional quotient test. WHO is more valuable than horoscope of better relationship. Personality test is more valuable. Hence, can be used in pre-marital and post-marital counseling. This personality program we added at our institute to get faster results, more clinical and truthful truthful results. And we save more than 70% cases of divorce. They are now happily married, enjoying the post-marriage life. Again, check we are prepared in each and every case, write down their name and all, the personality evaluation, write down strength. You are given 20 questionnaires of the strength. You are selecting one of these, is you are selecting for the four personality. Then suppose an adventurous, very powerful personality. Suppose here persistent, there is a perfect personality. To be sure, is a peaceful personality. Here there is a scoring sheet is mentioned. You write down there, then find out how much powerful personality 14 mark, popular is 20 marks. Means around 20 to 14, 34 remaining how much? Above 56. Take these two means the personality is perfect. Two personality you consider popular powerful need not change. It is the God given gift to every person. And I said the nature can't change, but it can understand the things. You have understanding insight of what your people's life, where you are lacking now, what you are doing in life to get you successful married life. And your personality evaluation, if you know the person, how he is powerful and popular, you will act like that. You will not talk that way. If people are perfect and with a weak personality, that will improve this peace. Big personality to saying his in about over and about the personality ask them to the relaxation methods, mindfulness techniques, meditations, and so it is the way advice should be given to your client and practice them because you made your own practical programs and accordingly you can change you can, but in you ask every this is 4 weeks more amongst the marriage counseling program where relationship is disturbed. We are going to see the cognitive behavior therapy, interpersonal therapy, acceptance commitment therapy, and problem solving therapy in future slides. Before that, I'd like to tell you the most important factor in counseling is visit model. What is this visit model? It stands for permission. You have to take the permission from your client that everything will keep the secret. Don't worry about that. Tell whatever you're in inside, and then we will find out limited information. Oh, size. Oh, I lost my image, so that I'm important and all. That is a masturbation and all the causing important or what. That is a limited information. Say whatever you eat daily, that again it prepare, it excess, it removes. Whatever you drink, water, excess water is removed by urination and so on. This is the same way this happens. So there is a 24 hours manufacturing of semen sperm count in your body. Don't worry about that. This is the specific suggestions you are providing to your clients. That is a please it, PLI, limited information, SS, specific suggestion, IT is intensive therapy, sometimes may be needed in the form of cognitive behavioral therapy and so on. We are going to see in future slides. I'm making it little bit clinical aspect and very logical way. Understand it so that you can understand, you can bring it in a practice and make it more result oriented to your client. Sex therapy is a systematic desensitization. Here, mode of psychotherapy where all 30 provoking stimuli are arranged in ascending level. Client is exposed one by one from least anxiety, pink stimuli, least anxiety. You have to ask the patient to go through it first for that one. Then higher anxiety, what you are calling. The most, meaning most of the time, most anxiety provoking stimulus means from least anxiety provoking to most anxiety provoking. You are doing something. The stimulus you are something. This is the introduce from step by step. This is the most effective way of therapy. Most of the time patient come to us. So, sir, I'm so much disturbed that I feel to go for suicide. Nothing in my life now. Marriage is the not only solution. Partnership is not only one part. Get the suicide. Give them asking what you want. That patient, lady or saying whomsoever, definitely I don't want to stay. I don't want like to see the face of that person or what. These are the story of my patients. Okay, I will tell them talk each other, but you have to remain in the one. If that is a part of our counseling. But they agree, then we go ahead. And this is the way they develop they know each other. There is no anxiety, there is no anger, and gradually there is a effective counseling. At that time, we ask them write down whatever you want the best in your life, wonderful, beautiful world, one page every day. Then write down about the responsibility. Is my work. I had done this. I have taken the lead as a leadership. And Brahmasmi means I'm everything. I'm the part of the God. And everything is happening with us because of not the because of the the person is the bad or worst. It is due to the because of the personality. It's God gift. It's a strong personality. The weak personality you have to make the strong so that it balance each other. This is the way you can solve the patients in counseling program. Then we are going to see today's chapter is pharmacotherapy in clinical sexology. My dear friend, I make it this thing is a pharmacotherapy is a PD5 inhibitors. These are tadalafil, sildenafil, vardenafil, and so on, papaverine, intracavernosa injection of papaverine, and so on. And newer drugs are also available here. How it acts? Phosphodiesterase action is a PD5 inhibitor, prevent the breakdown of cyclic GMP, causing enhanced relaxation of cavernosal smooth muscles. What is cavernosal smooth muscles? Inside the penile shaft. When you take section, there is the corpora cavernosa and corpora spongiosum. Increase the arterial flow into the corpora cavernosa, completion of critical veins, and finally penile erection. It helps in maintaining the erection and not the initiation. It maintains the erection, but not initiation. Initiation after giving any this phosphodiesters, you have to advise them or provide them some literature for erotic literature, fantasy and foreplay, pictures and or imaginations, and that will create the erection stronger and stronger and more time he remains and happily in the bed. Contraindication of the phosphodiesterase is nitrates and cardiac diseases, which leading to hypotension and optic neuropathy if the phosphodiesterase sildenafil, tadalafil, or vardenafil is given with erythromycin or rifampicin. So it is avoid erythromycin or avoid this if the patient on erythromycin or rifampicin. Sildenafil is available in 25 mg. It's called the Viagra, world famous name. 25, 50 mg, 100 mg, mostly 25 mg is not available. So make it the 1/4 half. 25 mg to start so that there will be no headache. Most of the time, patient complain headache. Minimum requirement is 2 hours to 30 minutes to get the results. Most of the cases is delayed up to 2 hours. And 2 hours before it occurs, you advise Viagra, sildenafil. What about vardenafil? Also 5 mg, 10 mg, 20 mg, you advise after action is mostly after 30 minutes of consuming this whenever it is needed. Tadalafil is the most suitable, most important, and most reasonable, available, and good results medicine. But between 10 mg or 20 mg, that is the previously when we was using newly molecule come in the market, then most of the patients with severe backache and acidity. And few patients are admitted in orthopedic hospital and paid a lot of money. And at the end, when they come ask us, we say stop the medicine of tadalafil, they are okay. No need of any hospitalization. But start with the 2 mg, 2 mg is not available, then 2.5 mg is available, and 5 mg you can start mostly. Its effect is after 8 to 12 hours. I advise after 1 hour after lunch, along with this antacids, any brandy and all. And this is the way what we advise this drug to the patient. Sometimes patients is not planned and all. That time they may use the injection papaverine and prostaglandin by mixed time mix combination available injection in their penile shaft, and they get the erection within 5 to 10 minutes, and you can ready for. After seeing the pharmacodiastates, then we go for alpha blockers. Alpha blockers and clinical therapeutic pharmacological use in sexual medicine. Alpha adrenergic receptor blockers dilate the arteries. They dilate the arteries and reduce the venous return and reduces the venous return. It dilates the arteries, the remain the blood more time there. Contraindication hypotension. If the patient is hypotension, you can't give this. These are the drugs available. Praducin available. Pradupress 0.25 mg tablet at bedtime. Terajusin, Hatrin 1 mg, 2 mg, 5 mg tablet available at bedtime. Incoming Valilis 20 mg tablet is at bedtime. Sulfadrin is calling 25 mg GDS 3 times a day. OMB 20, 1 to 2 tablet TDS. OMB used as alpha blocker. Dilate the arteries. Ergopramine 1 mg TDS. Intracameral injection for imagine. Pedramine can be used 0.06 to 0.6 mg is alpha blockers. These are alpha blockers. We have seen the 5 diastates, then 4 diastates, then alpha blockers, then third pharmacotherapy in clinical sexology is dopamine agonists. These that stimulate the dopamine receptors. Dopamine is a neurotransmitter. It causes vasodilation. Again, and an effect on blood vessel and endocrine system. These are these are the drugs mostly used, and the dopamine agonists are from 15. When that dose around 1.25 mg to 2.5 mg tablet 1 to 3 per day, needed more than 6 months. Phenpluramine labeling 20 mg tablet TDS injection apomorphine can be used. Few antidepressants are very commonly used in premature ejaculation in the female part. It's a very common problem with us. Either erectile dysfunction or premature ejaculation. Problem of the anxiety and all. Counseling, then add the medicine. Counseling with medicine works faster together. Not only counseling will help, both together will help more. These are selective serotonin reuptake inhibitor. It takes 3 to 6 weeks of continuous treatment for suppression of symptoms. They delay the orgasm. This effect is made of used in the treatment of premature ejaculation, for which the drug is given 2 to 4 hours before the coitus. Duoxetine use, paraxetine use, trazodone. These are all you know very well. The dosage. Gluten is very commonly used in sexologies, the DMG 260, but OD, see how it goes. But most of the time there is a see again acidity problem, so use with antacids. Because you know very well, erection, sometimes patient comes to you, sir, why is not affecting sildenafil, tadalafil, vardenafil, 5-phosphorodiazepam, not helping them. Then what to do? Because you have to give them some fantasy, some erection, and some this imaginary pictures, naked pictures, and all, and see after the medicine how much this effective. And the problems of both will solved by this way. Uh, but nobody will advise us things that you make them some literature, keep them. After the target such literature, you have to find out at home, and you will enjoy that way. It will more effective. But yeah. Very well narrators. Very well narrators we use. We manage the mechanisms and cause erection. They are also using potential also. Advertising sulfate diphilipine is used like IND, NMG. Amitriptyline is very common, but using in a hypertension patient. 25G. Pentoxifylline, and gentinol, nicotinamide is very common. Assumin sachet available. But I tried these things, arginine sachet. It as for the permanent, the permanent disease is nothing. So long you take it, it's okay. Advise them if you overweight, reduce their weight, reversible of their overweight. If overweight causing more secretion of estrogen in the body, and your weight is perfect like Shah Rukh Khan film star, then it is a testosterone body. Means there will be proper erection. And romance is very important factor. And Shah Rukh Khan is called as the king of romance in the film industry. That way you use them some things so that patient understand and they follow and they make something from inside. They change the behavior. And I explain everything. In short, I will tell you, I sit my patient, एक बार खाना खाएंगे आप बनेंगे योगी, 2 बार खाना खाएंगे आप बनेंगे रोगी, भोगी, 2 खाना खाएंगे आप भोगी, 3 बार खाना खाएंगे आप बनेंगे रोगी, एंड बार बार खाना खाते रहेंगे 3 बार आप बनेंगे महारोगी. अब diabetes, blood pressure, overweight, what not, you can't walk, knee pain, everything, kidney damage, heart damage, everything damage. So it is better. We are dying because of excess of food, not by starvation. So starvation is itself is a therapy. Fasting helps a lot. Nitrates, nitrates are converted to nitric oxide that relaxes the smooth muscles and causes vasodilation. Nitrates are used for angina. Angina chest pain. Children of children feel tadalafil should not be given to the person who are on nitrate. Again, 5-phosphorodiazepam is not used. Those are on nitrates. Hydrosulfide dinitrate sorbitate. If the patient is taking spinal, it should not use along with this tadalafil or sildenafil, Viagra and all. Okay. Then local vasodilator. For local application of drugs should be loss of titers, that is naproxen, ointment, Myovi, 2%, and 30 grams sachet, 1.5 centimeter area. Phenoxyethyl, mint top, 2% or 5% solution. Patient, why complaint? I don't know. After applying phenoxyethyl, I have done many things, but there is a myth about in dermatological in the patient mind, and sometimes they may be using some steroid that may causing up to certain extent, but minoxidil is not is a local vasodilator. It's helping in erection. Prostaglandin, again used with the prostaglandin with the papaverine, most commonly used in erectile dysfunction previously injections. If your dose is you have to go titrate the dose, otherwise the typism is a very common problem. Then you have to do the complete operation in the 24 hours otherwise. If you have to uh, surgical line of treatment. Those studies are all needed. For mixed vaginal infection is very common. Each and every out of 10 patients, 9 patients you get the fungal infection. Produce them fluconazole tablet or intranasal and if antibiotic infection as well as an azithromycin and all you have to get it. Generally, I'm using in terbinafine tablet and terbinafine cream along with this microdone powder. Ayurvedic adjuvant empirical treatment in sexual medicine in Chyawanprash is a tonic. It's called rasa and in Ayurveda. Chyawanprash minimum 2 TSF with the milk morning and evening twice. We go max forth 1 with milk. Configo 1 TDS 3 times a day. Oligoastenospermia. Vivadona is Ayurvedic twice in a day for female libido. Lack of interest in the female. You can use. These are all notes. We are saying you all the literature. If it is not available, then we send you again the preparation of today's in the form of already I posted you. You use it and see this. Antioxidants are most commonly used. Antioxidants are substances that protect the cells against the effect of free radical. This includes vitamin A, C, E, coenzyme Q10, zinc, selenium, lycopene, and L-carnitine. They improve the sperm count and motility and hence provide be effective in oligoastenospermia that leads to male infertility. Antioxidants are also available in vegetables, fruits, tomato, papaya, watermelon, fish, and eggs. You can take the good marks on these slides if you want. Coenzyme Q10 is very commonly used in oligospermia cases. Azoospermia hardly get any results. Oligospermia is in the most of the cases of 5 sperm count, 10 sperm count into 30, 20 like that. Vitamin A within a month or no, within 1 month to 2 months minimum, 2 to 3 months required. Zinc, selenium, 1 TDS. And you use along with the fertile tablet, fertile chlomophenolate. Hormones in sexual clinical sexology is testosterone increase the lifespan and fertilizing power of spermatozoa. It helps in the final maturation of spermatozoa during spermatogenesis. In hypogonadism, it stimulates the libido and improves the ED. In normal individuals, it does not improve the libido. or erection. Testosterone injections are used mostly in capsule form. It's available. It is very costly. Maybe around 40 mg in a day. One 3 days, one capsule 3 times a day, or two capsules 3 times a day for 3 weeks, along with 30 meals. More, you have to take the fats that in the form of ghee and all. Injection testosterone available. You can give the deep intramuscular 1 ml every 2 weeks for minimum 6 to 8 injection course you can get. Injection human chorionic gonadotropin HCG is available 5,000, 10,000, 20,000 internationally. You need use use for ovulation spermatogenesis. This in the test is hypogonadism case. Levonorgestrel is the problem. It's available for IP. Those are unprotected sex. As the patient unprotected sex is a big concept. Again, most of the time patient take it for the first week they after the ovulation they did it and they have no, that is between the ovulation period, that is after 1 week or 10 days of menstrual cycle MC. The beginning of cycle is ovulation. First 10 days should go between the big menses to IP. 22 hours skip valid. Within 2 to 3 days you have to use it. Otherwise there are chances of pregnancy. That is called Leo no not just still. Leo not just still. There is a hormonal treatment mostly gynecologists are providing. It's in the patient of you also the IPD can prescribe that. If they are done the sexual intercourse during ovulation period. Clomiphene citrate, clomid 25 mg for male we are using for oligospermia for minimum 3 months, 5 days in a week we generally use, and female 50 mg only for 5 days. It is from 5th to 9th day of menstrual cycle. The MC is over 4 5 days, then you start it 5 to 9th day, 50 mg OD for infertility cases. You can just clomiphene citrate. 6th day to 9th day. Now you know pharmacotherapy, you know Ayurvedic treatment, you know herbal treatment and so on, diet and all, because most of the times the normal way is to improve the testosterone. We generally advise pelvic seeds and pelvic seeds with vegetables. And most of the time female we advise is soybean to improve the hormonal status. Regarding sexual dysfunction, you should know anticholinergic, atropine, and panthenol causing the ED, anti-hypertensive, beta blocker, methyl dopa, ganglion blocker, SC inhibitors, antimicrobials, ethionamide, virama, antipsychotic drug tranquilizers, and antidepressants, CNS depressants, barbiturate pain, thyroid, and paranoid. Cimetidine, famotidine, antacids are used most commonly. The side effect on erectile dysfunction. Hormones, cypropiron, acetate, estrogen, steroid. Steroid is used mostly in dermatological hair, loss of hair, baldness cases. Because when I've seen a lot of patients after finasteride and they have got erectile dysfunction. That is hardly there is a 1 mg, 2 mg, 5 mg tablets, but they are severe. They are taken 3 months, 4 months, then the erectile dysfunction started. We advise them to avoid it, but the rule is advise them to regular use for their hair, strength of hair. We advise them to eat natural way by fruits and all, and instead stop. Recreational drugs, alcohol, tobacco should be avoided. Marijuana means that is that ganja and amphetamine should be avoided. Tobacco, alcohol, smoking avoided. Ayurveda, Vajikaran therapy, very important. Vajikaran therapy best we prepared one drug that is Ayur boost in our clinic name and that will be available soon. A basic brand of Ayurveda improves sexual stamina, fertility, and vitality. That we give herbs and then ashwagandha, spread muesli, silajit, topicottu, bokachurua, emphasis on lifestyle, diet, sleep, meditation, seasonal regime. We prepare this, we are manufacture it for our clinic. If you want, we can provide you on 50% reduction benefit to you for our all the students. Whatever cost, that cost 50% you will get it. Yogic asanas are very important. Bhujangasana, Pachimakasana, pelvic circulation, pranayama meditation, reduce anxiety, premature ejaculation, tantric sex. I written a book, and that book is a lot money, 40,000 rupees on Amazon. Mindful intimacy. People like North US and all union of spiritual. We advise them their spiritual chakra meditation and all kundalini awakening techniques and tantric sex. Therapy integration, erectile dysfunction, PD inhibitor, cognitive behavior. This is the way what we combine. PD inhibitor with CBT, cognitive behavior therapy for performance and next. Now you may ask how the CBT and all we are going in future slides. Don't worry. This is most important. Today maybe we do our complete session of 2 hours. Premature ejaculation, SSRI, sensory focus exercises. Hyperactive desire, sensory focus is they gradually go for not immediately. There is a Master Johnson therapy. We are going to see. Hyperactive desire, we use mostly levantine and testosterone coupled therapy. Hyperactive desire. Pain disorder, local therapy, relaxation, and dilators are used. Pain vaginismus is vaginismus is most of the time. Dyspareunia is due to the biological or you can say some organic cause or bacterial cause and all uh, fungal and bacterial combination. You can treat them very well. That was basic. But vaginismus is psychological and vaginismus generated will be pain. Or people are trying for botulinum toxin injection in resistant cases. Topical estrogen or lidocaine gel for pain. There is now numbness cream also available. Always combined with psychotherapy, pelvic floor physiotherapy, and gradual dilatation therapy. And I use in my, I had few cases of vaginismus. I use shockwave therapy. I got male erectile dysfunction. I use in the low frequency to on female to just to be stimulate gradually muscle relaxation and then advise them local anesthetics, numbness cream like, and then advise them to use the dilators. And that lady keep the dilator whole night. And then second day they come, she came, I'm okay. But don't advise them keep whole night. Don't give more than 2 to 3 hours in vaginal dilators. In a particular position, don't move here and there, otherwise damage the vagina. Anxiolytic short-term benzodiazepines, antidepressant acting, combined therapies, or testosterone replacement therapy and hypogonadism, estrogen replacement in menopausal women. Menopausal women, you cannot let them what? Sorry, if you want for born. Now, male oligospermia converted 25 during 3 months for me when estrogen evalon. The estrogen cream is available is for female intravaginal use in senile atopic dermatitis, mostly after menopause. Complaint dryness in vagina estrogen. Evalon is available. Evalon or Dino store cream available in market. You can advise them. So everything is normal, then still the patient is not. They have the fertility issue. At that time, we advise take the sonography of the uterus and find the position of the uterus. If it is antiverted, hold them. Missionary pose, it goes man up on top. If is a retrograde uterus, use the doggy pose. As the most of the patient has, after taking treatment of 1 month, only position change and they are conceived. So you have to think in all the aspects, psychological aspect, physical aspects, means exercise and all, diet aspect, medicinal aspect and all, multi-therapeutic approach, multi thinking about treating the cases, counseling part and all. Intracameral injection, mostly papaverine, you have to prepare papaverine, pentlamine, prostaglandin, injectable income. Vacuum devices, non-invasive, inexpensive. Vacuum device nowadays is nobody's using. Previously, we are using lot every patient wearing vacuum device, use the vacuum device. Now we never use. Better instruments are available, like shockwave therapy and all. Psychotherapy. Now the part comes. What is psychotherapy? Psychotherapy is a part we are describing counseling is all the part of the psychotherapy, but we will see in what reality how we define it scientifically. Psychotherapy plays a central role in the management of psychosexual problems. While counseling addresses present concern through guidance and education, psychotherapy works at a deeper psychological level, helping clients identify, understand, and resolve the unconscious conflicts while adaptive beliefs, whatever in the subconscious mind. Exploring the subconscious mind, what we are something. Emotional disturbances that interfere with the sexual health and relationship. Most of the time, the emotional disturbances, they are so much worried. Oh, I'm into negative. You have to remove negativity and make them in positive way. This is not my solution. You will be positive in life. Nothing will happen to you like that. Motivate it. Psychosocial dysfunctions are often multi-factorial, medical, psychological, relational, and cultural. Psychotherapy provides the framework to address the psychological and emotional roots of the condition. Okay, fine. These are the things you have to improve in psychotherapy. Objects of psychotherapy in sexual health, reduce anxiety. Reduce anxiety. Most of the time I've seen patients are very well treated with fear of performance rubric in the homeopathic. The medicine is agentum nitricum. 30 to 20 because 30 potency is not working past 4 to 100 potency or 1 in potency. There is so conflict, mind is so fast. The higher potency you use in homeopathic. Helping it. So argentum nitricum, remember everyone, 200 is available any omega, so you can buy it. Hardly costing that. But use the thousands of patients by putting 2 3 drops in the movies and then take it. They'll do results. Correct irrational or dysfunctional belief just reduce the anxiety. Correct irrational and dysfunctional belief about sex is called unconscious conflicts contributing to the dysfunction, improve the self-esteem and body image, enhance emotional intimacy between partners, supports behavioral changes through structure technique. Okay. Major psychotherapy model in sexual medicine. Now, my dear friend, topic is high, bigger one. Major psychotherapy model in sexual medicine is cognitive behavior therapy, CBT. Cognitive itself is the brain, thinking. Focus on identifying and modifying the dysfunction of thoughts and behaviors. In one day, how many thoughts? 50,000. In every 2.5 minutes, 2.5 seconds actually, one thought. In 1 minute, around 20 to 30 thoughts comes. A man with a premature ejaculation believes, I have no control on cognitive behavior. Restrict belief into restrictions. I can gradually learn control through the practice. When the patient fixes in the mind, I have no control, you have to make them cognitive behavior therapy. I can gradually learn to control through the practice. Here I like my patient along with this. Is I'm named this as a Master Johnson shock therapy. Because experience in advanced Master Johnson therapy is very active. Whenever you feel that when during the intercourse you are going to ejaculate, you remove your penile gland. Again, you put it and remove it. And give the strokes continuously. And forget about your don't do it mechanically such a way so that your mind will not be in the sexual feeling and giving your sending the messages to your limbic system of sex center in the brain, and that will help you a lot. And patient do for 10 strokes, 20 strokes. And most of the patients say, I can now perform 40, 50 strokes without any ejaculation. That is the best therapy for Master Johnson therapy in the way counseling during you can. This is the way what you can have your own tricks to do, apply to the patient so that patient will get more benefit. That's not like a general rehearsal, great exposure, relax. Psychoanalytic psychodynamic therapy explore the unconscious conflicts, childhood experiences, and refresh emotions. Okay. This is a cognitive behavior therapy. Psychoanalytic psychodynamic therapy. Psychodynamic therapy explore unconscious conflicts, childhood experiences, and repressed emotions. Most of the child experience and then fix up their mind, they remove this. Behavior therapy uses conditioning and desensitizing technique. Example, systematic desensitization with gradual exposure exercises for erectile anxiety, often combined with the sensor focus exercise. What is sensor focus? We are going to explain you again in the future slide. But before that, couple variety therapy focus on improving relationship. That you have to improve that, find out the personality evaluation and say, see, the person as such is good. This is a weak personality, the dominating personality. You can't change it. Two personality always create God gift personality. For out of four personality, two personality you can't change it. That is God gift. Two weak personality you can change it. I'm here taking your class because my personality is dynamic. My powerful personality. So I can't change. You can't change me. I will lose. My weak personality is the peaceful, perfect. Then I do the meditation, relaxation techniques, yoga techniques, and gradually improve myself. This is the way what you have to understand yourself first, then you can use on your client. You can improve the relationship dynamics that influence sexual satisfaction. Techniques, communication training, problem solving, shared intimacy exercises. Mindfulness based therapy teaches client to focus on present sensations without judgment. Helpful in performance anxiety, premature ejaculation, and orgasmia. There is no orgasm. An orgasm. Group therapy. Group therapy supported settings reduce the isolation, normalize the experience, and provide the peer encouragement. Practical techniques used in psychotherapy, relaxation, breathing training to reduce the performance anxiety, cognitive restriction, restructuring, changing negative sexual beliefs, imagery guided fantasy for enhancing arousal or reducing avoidance, and role playing for practicing communication and intimacy, homework, assignment, sensory focus, self stimulation, and partner task. Sex therapy, classical sex therapy model, Master and Johnson sex therapy model, 1960s. Before that, all people, all doctors, everyone thinking that male is active, female is just passive. Female has nothing. Female has no desire, only male. Then 1960s, after this research, behavioral and couple-based approach, he said equal desire in both male and female, equal excitement in both male and female. Focus on sensory focus and removing performance anxiety. Then comes Helen Singh and Kaplan, sex therapy model 1970 to 80s. Triphasic model integrating desire, arousal, and orgasm, psychodynamic and cognitive behavioral element. Here, how we can structure it. Mostly remember psychology of sexual cycle is that first come desire. Desire is come in desire, then there is a erection, erection, then ejaculation, orgasm in male. In female, desire is equal desire. Instead of erection, there is a more secretion, more stimulation. Pelvic flex, and this is the thing in female are more and more secreted. Female are more orgasm after orgasm in female because the female orgasmic organ is clitoris that is the main outer part of the body and touch with the cloth and this enjoying every step of talk and sex, sexual these things. And the things female are more stimulated again and again. Male get the erection when ejaculated, male resolution phase maybe 2 hours, maybe 6 hours, maybe 12 hours, but nothing like this in female. Female gets stimulated again and again within a frequency, within a minutes, here is how we can structure it. Sex therapy model, Master Johnson model, background developed in 1960s by William Masters and Virginia Johnson. Core idea: sexual dysfunction is the best treated in the context of the couple, not just the individual key features. Dual therapist team, male and female therapists working together, 2 week intensive program with daily sessions. Now, sensory focus. What is sensory focus? Is a phase one, non-genital touching. This male and female part together, non-genitals. They do talk. They stimulate each other. They know each other. They use the performance pressure, increase the intimacy to know each other, to have good sympathy, caring, and all the things. They do genital touching. Then phase 2 after 2 3 days. They do they can go for genital searching without intercourse. They will not do the intercourse, only cut and the sterile. It's an intercourse which focus on pleasure, not on orgasm purpose. Focus on pleasure, how they enjoy. Means foreplay is more and more factor here. They were not introduced, still female ask, hold the organ in the hand, then they introduce. They go on foreplay, mid part should go on foreplay and kissing and whole body and all like that. But these techniques is very important. Each and every patient, you have to give the training so that they can perform well. Focus on reducing spectatoring, self-monitoring during sex. There is these things. Ask the patient. Don't monitor yourself, how you are performing orgasm. Only think about the pleasure. Sex therapy is for Indian concept. What is the sex therapy as per the Indian concept? In the Indian context, sex therapy is deeply influenced by Ayurveda, Charakshamsa, Susruta, Samhita, sexuality as a part of Chaturvidya, moksha, Purushartha, Dharma, Artha, Kama, Moksha. Kama Shastra, especially Varshan Kama Sutra, second and fourth century, and sexual pleasure integrated with love, duty, and aesthetics. That's why cosmology is very close to the sexology. Look, tantric and yogic tradition, energy balance, frequency, wave therapy, chakra, prana, brahmacharya. Brahmacharya is not like a sublimation of sexual energy. That is energy creation. What is brahmacharya? We will explain in future. Modern Indian psychosexual therapy, combination of Ayurveda, yoga, counseling, cognitive behavioral therapy, Western sex therapy, knowledge, but tailored for Indian socio cultural values, arranged marriage, family, pressures, and taboo on discussing sex. Sex therapy in the Indian philosophical foundation, sexuality as a part of holistic health. Ayurveda described sex as a one of the first symbol, three pillar of the life: food, nidra, sleep, brahmacharya, regulated sex life. Brahmacharya is not absence of the sex, regulated sex life. They are doing the sex, but regulated sex life. Three pillars of life: ahara, nidra, if there is sleep problem, if there are food, I told you. One time food is yogi, two time food is a bhogi, three time food is yogi, multiple food eating, every time eating is marugi. Balance, sexuality, longer lifespan, mental stability, relations. You say same sentence to your patient so that patient will reduce their weight. Otherwise, they can't understand the things easily. Those any month like that. You have to give them some harsh things like that. You decide yourself. But smoking alcohol you can do, but smoking causing इलेक्ट्रा मैं यहाँ मेडिसिन दे रहा हूँ वो इफेक्ट मिल जाएगा तो दिन के बाद मेडिसिन बंद don't ask me permanent relief. If you want for long lasting permanent relief, you have to do all this. Imbalance, excessive intelligence, suppression will physical and mental disorders. Okay, fine. Now, my dear friend, most of the things we cover. Now, I'm not taking again. You do this all what you learn today. Write down in the assignments and send to us so that it will become a part of first session, second lecture, third lectures. So that these are the work. It is a certification you get it more creditable under CTA and under institutional membership and under the certified educator, sex educator certification, we will give you separate certificates, extra certificates. Those who provide me all their assignment properly. Do it yourself. I'm not going, you are not child. I'm not teaching you stupid. Learning is something you come from inside. Hopefully, learning is not done. Learn and learn means you should know, understand yourself. And you might learn what is the things, what I learned today, what pharmacotherapy I can use, what counseling I can do, how I can improve myself, and what is my prospect, what is my thinking pattern now, thought level change totally like that. This is our first session of assignment. This is our then the food assignment. I told you diet program I have taken in the first lecture itself. Testosterone body like Shahrukh Khan, like that. And then assign how to personality I completed. What? Oh, I'm sorry. I'm sorry. Even if you are not wrong, say you partner, I'm sorry. That is the best way to your girlfriend. Send her first, okay. Meridian, whatever body organs are reflected on the body is called the meridians, the heart meridian, kidney meridian, and urinary bladder meridian. And lung meridian are most effective meridian for sexual because energy is required. Emotion is required, heart meridian. Then kidney and urinary bladder meridian related to urethra and this thing, erection and all. So yeah, this is one assignment. We are taking it how to stimulate it with the TENS, transcutaneous nerve ending stimulators. We have with the acupuncture punch stimulator vibrators frequency we had developed an instrument. You can use that instrument very cheaper. That is for the patient is around 15,000 per hour. Student we are charging all the cost 10,000 or something. That is you can see that is lung meridian used for sonography. These are things you mentioned. Urinary bladder meridian, arthritis, joint pain, lower back pain, constipation, fatigue, rapid pulse infection, prostatic decrease, sex drive, urinary bladder, stimulate the urinary bladder, see the effect. Kidney meridian, stimulate it, see the premature ejaculation and other things, and sexual dysfunction, impotence cases, hereditary weakness, all removed. These are the acupuncture part actually. But it is very you should know. Your multi-therapeutic approach, then you can cure long-lasting results. Not only by allopathic medicine or Ayurvedic medicine alone, you can cure the things. Multi-therapeutic approach. Open your mind, keep your mind open, and give the therapeutic approach to the patients. Counseling, the is very important to each and every case. Write down consent. I'm willing to so and so. This is consent of that so and so. Bark flower remedies are very important. Most of the time, these are the 30 remedies. You can get it very easily. You can use, anyone can use it. No need to you have to be homeopath or allopathy. Anybody can. Smile, hidden inner worry. ऊपर से आता है अंदर उसको बहुत दुख है एग्रीमनी दे दो उसको ड्रॉप कर दिया हस्बैंड एम्परेटिव अननोन फियर अरे यार कल क्या हुआ ओ बाप रे what will happen in future don't think about the future remain in presence do that thing 2 3 1 within a week he changed his mind spirituality oh sir you are very this is the you read all these things I have given you sex therapy or this devices, things and EMS. I'm providing you this. You can see the machines, you can use it. Start, huh? These are the, some few things I like to tell you. Man, X XY is the female, XX is the male. Okay. Orgasm is male. This male attraction. Okay, this part we will take tomorrow because 1.5 hour. I think it's too hectic now. It should have. Delete all these things. Now close here. Uh, I will close here. Thank you, everyone. And today meeting we will declare here over.
Thank you. Good
We'll
night.
meet you next. Yeah, next. Yes, sir. Again, this you can video, audio of all these things. Already it is on the my YouTube channel, so you can read it, you can get it and do it yourself. You
Oh,
made yourself
okay, sir.
what to do. Yeah, that will help you a lot.
Thank you,
And
sir.
we'll soon. Welcome, welcome, welcome. We will take a one dermatological aspect of it. If you are interested in dermatology, we will take it. Most of the part is over sexual medicine, but we will take dermatology, Botox and all. And we will take dermatological diseases and all. We will cure that also. We will take that part. Okay, we'll see you soon. Uh, we end the class here. Thank you very much. And give your feedback on the our group so that we will improve ourselves and we'll help you a lot in the next batch. See you. Good night.
Good night, sir.